Greetings from Brain Spine and Joint Clinic. अभी हमने रिसेंटली एक वीडियो सीरीज स्टार्ट करने का सोचा और वो वीडियो सीरीज है न्यूरोलॉजिकल रिहैबिलिटेशन पे. In this series, we'll be talking about different neurological disorders, ailments, diseases, and their possible treatment plans, the best possible treatment plans rather, and of course, answering all your queries. So you are most welcome to take up your queries with us regarding the neuro rehab. So we're talking about different diseases and disorders turn-wise. The first topic I have picked up is facial weakness, and in that category I'll be talking about Bell's palsy. Since it's the cold winter weather, so there are the number of cases and good amount of cases with Bell's palsy coming to our clinics for rehab. Bell's palsy, as known as the facial paralysis, is a very common thing happening in winters or in extreme cold weathers, and it is also often neglected thing because usually the recovery the recovery rate is good, and it happens to get recovered in say a month or so, or maybe less than that. I'm talking about the complete recovery. Otherwise, the symptoms starts vanishing between 7 to 10 days. But if left untreated, it can cause different other issues by affecting different muscles, even up to your neck and chest and below, because it disturbs the whole kinetic chain. Now, this kinetic chain is I'm referring about the linkages of the muscle with one another. Talking about the Bell's palsy. Now, it can happen in anybody, any gender. It's not like it's more prone in men or women. It has an equivalent rate. So most of the causes are idiopathic. It may happen all of a sudden or may have an underlying disease. So, but the majority of the cases are idiopathic or unknown cause, or something might have happened a few months back or few days back. But there is a category of people who are potential risk holders. First one being anybody with infection of the inner ear. If we do not cover our heads or our face during the cold winter weather, or suddenly the cold blow of air passes through our ear, there is strong chance of getting the paralysis of that side. This is the reason why doctors usually recommend, or we people usually recommend, to cover your head or cover your neck totally wrapped up in a warm cloth during the winters while you're going out, even if you're traveling in a four-wheeler, because once you get out, there is a strong chance of getting the cold air hitting your eardrum or behind the ear. People with uncontrolled diabetes, history of herpes zoster virus or Varicella virus, they have strong tendency of getting the facial palsy. Then another category of people who might have met an accident, tumors, or some infection in the brain which has traveled to the facial nerve. So these are the people who are having the great risk of getting this Bell's palsy. Now, Bell's palsy is named on the phenomena known as Bell's phenomena, and what happens in it is when the face is paralyzed and the patient tries to close his eyes, the eye on the paralyzed side cannot be closed, and the eyeball moves upwards like a bell. Like when we ring the bell, it moves to other direction in the upward scenario. So in that, this is the phenomena known as Bell's phenomena. The eyeballs rolls up while while the patient is trying to close the eye. Now, also while we try to smile, clench our teeth, the lips do not give a complete closure, and the patient has to put on so much effort to bring the tooth line close. So while to close it, the patient might do like this. So this is the reason, this is the whole set of findings in the Bell's phenomena, and hence it is named as Bell's palsy. Now, We have so far discussed about the potential risk factors, what is Bell's phenomena, what happens in it, and then there are further three categories into it. It can be unilateral, where it can be bilateral. In unilateral, there are two categories. In unilateral, we either the lower part of the face only is involved, sparing the eye. So that kind of patient would not have much issues in expressions of the face. So as we know, facial muscles are used for the expressions. They are also used for different daily activities like blowing the cheeks, blowing the nose, which we use during blowing the candles, or you can say cleaning up something, we might blow air on it. Clearing our nose requires flaring up of the nose, our expressions like anger. Then in activities where we are swallowing something, so our cheek muscles are used for chewing the food, the muscles are used for drinking the water, sucking the fluid inside us, the facial muscles are used. So all these activities will be affected, or many of these activities will be affected from some degrees to much amount. So all these factors, all these activities will be affected in Bell's palsy. If only the lower part of the face is involved, then that is concerned with the problem on the opposite side of the brain. If both the sides are, both upper part and below that the lower part is involved, then there is a problem on the same side in the brain. It can be of any origin. It can be an injury, it can be an insult to the brain in any form, like a tumor or infection or demyelinating disease or something like that. Something like that includes vascular changes also. If both sides are involved, then it is considered as bilateral involvement. That means both sides are involved, and it corresponds to pontine changes. Pontine changes means there is problem in pons, and pons is a part of brainstem. So there is a huge chance of a tumor or an injury in the brainstem, or some underlying cause which gives the bilateral effect of facial palsy. But the commonest one is the half-sided, and mostly the lower part is involved more than the upper part. That is the reason the recovery in the upper part is quicker than the lower part. Now during the this was all about the Bell's palsy, different categories and the involvement extent. Now the immediate effect what the patient feel is, there could be a pain right behind the ear on this bone which is known as the mastoid. There could be a pain of varying intensity. Maybe it is sharp for someone, maybe it is worst for somebody, and maybe it is unbearable for somebody, or maybe it is just a mild pain for somebody, and that course may continue for 48 hours. There could be a little swelling, and there could be some kind of twitching over this area, or might just only be the pain present, and it has to be diagnosed by a medical professional, and it is managed by giving some anti-inflammatories, steroids, and antivirals if virus is the cause. So this is all about the what and how of Bell's palsy. In the next video, we'll be talking about the treatment, the exercises for Bell's palsy, also the different approaches being used, and the self massage for Bell's palsy. Thank you. Stay tuned.